Hi everyone, good afternoon, good evening. How are you all? Hello. I think you guys are on mute, but we can test text. Is it? Uh, yes, good evening everyone. Am I audible? Hello. So sorry, I think we're 5 minutes late. Let's just start. Yes, guys. We will start. We will start in a minute. How are you all? People are still joining. Okay, guys. So yeah, let's start. Let me just do one thing. Just give me 1 more minute, guys. I'm so sorry. Just 1 more minute. Yes, guys. Good evening. So finally, I'm here. Thank you very much for waiting. And sorry again. So good evening, everyone, and I welcome you to this webinar. And this webinar, frankly, if I tell you how it has been started and how did I, come with this webinar, was that last, I get many questions every time. I mean, almost every day I get questions from you guys, from the students, from my interns, from wherever I go, wherever I meet people, and they email, they send in the WhatsApp, they ask a lot of questions about the career opportunities, right? So last month I was on the tour. So first I went to Chandigarh University, and I got the similar questions. Then I thought let's do something, and I have come up with this topic of top 10 uh, career options. So I did a research. I did a I asked my friend who are working in the industry, and the people who are actually I asked the students how they want to go to and what they want to choose, and then based on that I searched again, and based on that I came up with some specific career options which are now trending, and which I believe are must go for if you are a PharmD student, BPharm student, or MPharm student, or any kind of pharmacy professional or pharmacy student. So these things I hope would be useful for you, and today's webinar will give you some glance on your career, and I'll be helping you, and you can ask me as many as questions you want. So guys, first I would like to ask you a few questions. Uh, Guys, first of all, you can introduce yourself just by your name and from where you're joining, and which year of PharmD or BPharm or MPharm you're, right now in. And tell me one more additional question to it, to every one of you here and in YouTube. YouTube also, there are many people have joined. So you have to tell me, what do you want to do? What are your, dream jobs, or what are your career goals after your pharmacy degree, please? So can we start with that? Yes, everyone, your name, from where you are joining, in which year you are studying. If you wish to, you can introduce yourself, and with this answer, like what are your career goals in the future? Yes, people. And the people from DY Patil Pimpri already have gone through this presentation, I believe. So yeah. Okay. Okay. But yes, you can come up with the new questions, and I have come up with some more new things. Just completed my BPharm from University of Kashmir. Fantastic. Okay. Clinical research. I am interested in research. Okay. Spurti joining from Mangalore, second year, Parth. Okay, research. You can answer this question also, guys. What are your career goals, and what do you want to actually do after your pharmacy degree? Okay, after your pharmacy degree, what do you want to do? That also is one of the important question. Okay, medical coding, fantastic. Drug inspector, BPharm sixth year from Bhopal. Okay, so guys, I would suggest you to come up with your full names, actual names, not the iPhone or destructor or something. Please come up with your original name, so I can call you by your names. Okay, please write your original names, everyone. That would be great for me to identify and call you by your name. Okay, so medical coding, fantastic. Clinical research associate. Okay, clinical research. Okay, clinical pharmacist. Fantastic. PharmD postgraduate from JSS. Clinical research. Okay, research and development. Fantastic. That's also good. Okay. Industries. I'm interested in field of pharmacovigilance and quality assurance. Okay, dermatopharmacy. Oh, that's amazing. Sri Manasa is telling dermatopharmacy. Wow, pharmacovigilance. Okay, head Yeola. Okay, from you want to do the clinical research in cosmetic science. Oh, very nice, very nice. Trying to attempt the Oprah examination Australia. Okay, Rakesh, thank you, fantastic. And drug inspector, fantastic. There are many answers, guys. Lovely. Thank you very much. Thank you for your answers, guys. So let me tell you a few things before I go with the presentation. That today, not only some 10 or 12 career options I came up with, but along with that, I have come up with with a very specific, one of the higher education option also, which is very trendy for years, for the decades. People do MBA after BPharm, right? People either go for MPharm, or people used to do MBA after BPharm, right? But today I have come up with some specific topics in MBA, some specific career options in MBA, and some specific domains in MBA, which you might have heard or might have not heard also. Okay, so see, when I talk about the career options, I could take it for many topics. I could take it for many days with you. But today's, as you must have seen the flyer also, today's webinar is a very specific topic. I mean, very specific industrial aspects we'll be talking about, and I'll be talking about MBA also. And you must have seen the brochure, the flyer. There is something called P1. So don't worry, this is just a part one. I'll be coming up with multiple similar webinars for all of you. Similar means you will suggest me after this, you will be asking your questions, and as we cannot complete everything in 1 hour, 2 hours, or 1.5 hour. So my next webinar will be on your topics or your question, based on your questions and based on the things what I'm not covering today, right? I mean, you might have the lot of questions to me today, and you may be having a lot of other career options to know for. But if I'm not completing today, next time, based on your interest, I'll be coming up with that. Okay, so I have planned almost 4 5 Sundays for this, not continuously maybe, but yes, in next 2 months I'll be taking 4 5 webinars on the same topic, career options. Okay, so 2 months back, we have conducted a wonderful 5 days program, Career Conclave, also Pharma Career Conclave, where we have discussed about the international pharmacy licensing exams for, for Canada, for USA, for, UK, for Australia. Many things we have discussed, and the industrial aspects also. But as much as I want to talk on the career options, it's very less only for the students. And in last 4 5 years, and mostly in last 1 year, since a new batch of interns have come, I have taken multiple seminars and multiple webinars and many interactive sessions on the career options. But again, it is like never ending topic. The discussion can go for longer term. Discussion can go for days. The discussion can go for many topics, many domains. So without a delay, let's start. Let me tell you guys, so whoever is staying with me till end and filling the feedback form will get the certificate. Okay, everyone is not going to get the certificate, right? So whoever is staying with us till the end and filling the feedback form, and that is your attendance form. Okay, so only those people will get. If you are telling me, sir, I have joined for first 50 minutes, first 60 minutes, first 40 minutes, and I should get the certificate, no. And let me tell you, in starting only, this webinar will go for somewhere around 1.5 hour to 2 hours. Okay, 1.5 hour to 2 hours, because if I am coming up with any seminars or webinars, I must take your all the questions, and I must try to get all the answers. Okay, so let's start. Let me share the slides with it, guys. Let's not delay. Okay. So guys, you can just confirm with that. Okay, you can see my screen, and you can, you can see the screen, right? And that is also in the full screen. Is it visible to all of you? Okay, let me just keep the YouTube also on my in my side device. Let me keep my iPad on so I can see the comments there also. Okay. Otherwise, it will be difficult for me to see in the laptop. Okay. Just give me a second, guys. Let me keep my iPad also. Okay, so by the time, tell me the next question, how many of you wants to become the clinical pharmacist? How many of you wants to go for the clinical pharmacy? Yes, guys. Okay, so by the time, okay, one sec. Yes, fantastic. So I can see the comments now. Yes, I can see the live chat also now. Perfectly fine. Yes. Okay, great. Yes, guys. So clinical pharmacist, how many of you want to become the clinical pharmacist? Me. Okay, lot of me's I can see here. Okay, so fine. Let me start now, guys. So this is the today's webinar is on top 15 career opportunities for pharmacy students, and let's start. So there is no conflict of interest, definitely. So emerging options, as we can see here, this picture has been originated by ChatGPT. So let's talk about the use of AI and the technology. So here you can see there are a lot of wonderful topics, a lot of wonderful things you will see as people are telling that we want to become the clinical pharmacist, right? So here, one sec, sorry. So I think this pan is not. Yes, guys. So my pen and notepad is not working, but that's okay. We'll discuss, without pen. That's okay. So as you can see in this picture, uh, you can see there that, the here, if you can follow my cursor, there is clinical pharmacist, right? So many of you have come up with the answer that you want to become the clinical pharmacist. Okay, you want to become the clinical pharmacist. So I would like to ask you that why you want to become the clinical pharmacist. But before that, I would like to put my perspective, because we have already, we are already 25 minutes late, and I don't want to keep it more late. I just want to tell you why I feel that clinical pharmacist job, uh, first of all, let me take you to a brief history that BPharm is very old in India, right? BPharm is very old in India, and if I talk about India only right now, we had something called DPharm that is still there. I mean, the diploma in pharmacy is still there, which is a 2 month, I mean, 2 years diploma, and then we come to the next, which is degree BPharm, and then we recently in 2008 introduced Doctor of Pharmacy, right? So after B Farm, there is M Pharmacy as well. So this is the basic structure, right? So previously, we did not have this term called clinical pharmacist, right? I mean, before PharmD in India, we did not have clinical pharmacist term. So this term was called as hospital pharmacists or community pharmacists. Okay. And hospital pharmacists, usually before 2008, these people were working as hospital pharmacists. Who were working as hospital pharmacists? DPharm guys, right? Diploma in pharmacy people were working as the hospital pharmacist. And then the BPharm people were usually made for, or usually, these people were trained for the industry. Industry means, for the marketing, for the R&D, for the, analytics, for the, pharmacovigilance, medical writing, and other things. Before 2008, this was the common scenario. The common scenario was that hospital pharmacy or community pharmacy, or the pharmacist, which are selling the drugs, the medical shops, these were usually run by the D farms, diploma in pharmacy, and most of the industrial jobs were done by the B farms and M farms, right? But now the scenario is shifting. Scenario has actually changed since we got the PharmD in India. I mean, though we did not see much change, because we are clueless right now, and people are also clueless who have, brought this PharmD to India, were also clueless, frankly, according to me. But the change, the major change, yet to come. Okay, it is yet to come. It has not yet come, because right now we are just 7 8 years old. 7 8 years old. When I say, it is like, your first batch has come out in 2014, and since 2014 it is just 11 years, right? So your maximum 10 batches are out, not much. And people are finding the path. People are just, going to find the new career options. And now for last 5 years, 4 years, since the corona has come, the drastic changes have come into the career options, because most of the, jobs have become work from home, like medical writing and medical scribing, and medical reviewing. Lot of new jobs have come up, right? Lot of new jobs have come up which can be done from the home, which can be done as work from home, right? So these things have been, changing since the, decades, not only now. And now, if I just give you a little more brief about outside, when the term called clinical pharmacist. So when you see in UK and US, actually in US, if I talk about in US, uh, okay, so I think guys are doing marketing also here, huh? Okay, so can you please stop this? Otherwise, we have to take you out from the class, Rajesh iPhone. Okay, so let it be. So guys, this PharmD in America or USA, what we call it, they have started the PharmD in 1953. It's almost 70 years, I mean almost 70 years old. And they have the very well established setup. They have very well established scenarios. They have very well established hospitals, and very well defined roles and responsibilities for families. Very well defined role and responsibilities, right? I was talking just in the morning. I had a meeting with some US people, and with some people from medical affairs in India, and they had only one question. They had only one question. Even I asked them this question, like, why Indian PharmDs? Why Indian PharmDs, guys? I'll come to the B Farm, M Farm also, but I'm just talking about PharmD first. So the Indian PharmDs, why they are fighting for industry? Why they are only fighting for industry? Why US people, US PharmDs are not going to industry? Why Australian PharmDs are not going to industry? Why UK PharmDs are not going to industry? Because they already have the well established setup. They already have the well established hospitals. They have the well established, well defined roles and regulations, and responsibilities for their work, right? Like what to do, how to do, and what they have to, how they have to plan, right? They already have this. But in India right now, we don't have some good people, some good people. When I'm talking about is the regulatory. Okay, we don't have the good regulators. We don't have the good people who are looking after us. We don't have the people who are taking care of the colleges. Taking care of the colleges, again, I mean to the PCI. Because if we have the good rules and regulations, we don't have to suffer much, because they will come up with some new and good policies about the things about the jobs, about the new options, but we don't have that right now. So I believe that I mean the PharmD in India is very fortunate that now we are coming up with multiple options, multiple career opportunities. Frankly, otherwise, if this is like, you will be definitely in the hospital, you will be getting a good role and responsibilities. But if we don't have, like now, we are searching for new opportunities, and we have multiple opportunities. As I always say in my webinars and seminars to all my students, you can go anywhere. You are open to go to the medical field. You are open to go to the medical field. When I'm saying, it's about PhD, it's about the research, it's about research in genetics, research in cardiology, research in rheumatology, research in psychiatry, research in general medicine, research in antibiotics, anywhere, research in cancer. So you can go to any field of the medical side. Okay, medical sciences. You can go to the research. You can go to the AI. You can go to the technology. So you can go to the food industry. You can go to the biotechnology. So when I say, I mean, you have a lot of options. Actually, you have a lot of options. But this is like, we just want to become the clinical pharmacist. A lot of you people think just we want to become the clinical pharmacist because it is the defined job. It is the universal thing that after PharmD you will become the clinical pharmacist, right? But the thing is, see, if you are becoming a clinical pharmacist, this is, I think you have heard me for this multiple times, but when I talk about this, many people agree, and a few people disagree to this sentence. What I'm going to say is, like, see, if you become a clinical pharmacist, guys, you might be agree or not, but when you're becoming a clinical pharmacist, what will be your salary? Okay, let me tell you the highest. It will be 40,000. 40,000 INR per month. Is it? Am I right? 40,000 per month. Do you get this as a clinical pharmacist anywhere in India? 40,000 per month, guys. And starting after PharmD. You just write yes or no. Okay. And other than that, my second thing to you is, see, you will get a lot of new options. I mean, you will get a lot of new names. If I say options name, when I'm talking about clinical pharmacist, somebody is giving you clinical pharmacologist, somebody is giving you clinical pharmacist, somebody is giving you head of clinical pharmacist, somebody is giving you some different names. You will get different names. You will get, okay. I mean, at their convenience, at your convenience, people give you the designations, people give you the name. But when it comes to the money, and when it comes to the jobs, when it comes to the responsibilities, it is not. It is really not. Because see, when it comes to the salary, we don't get this much in India. We don't get 50,000, 60,000, or we don't get hourly basis, or we don't get in the dollars, or we don't get 300 per hour, or 400 per hour, or 500 per hour, or maybe not in per hour, but we don't get even 50,000 per month, right? For 8 hours to 12 hours job. Our job hours are also 12 hours sometimes, but we don't get this much in India, right? So clinical pharmacist, first of all, if you want to learn, if you want to get exposed, definitely clinical pharmacist job is wonderful. Okay. And if you want a stable job to be at one place and do it, it's wonderful. But if you really, I'll come to the other pros and cons also, but let me tell you some stories before that. If you are becoming a clinical pharmacist, tell me, after 2 years, suppose you are clinical pharmacist right now, joined as clinical pharmacist after PharmD, you will become the senior clinical pharmacist. And after that, you will become the chief of clinical pharmacy or head of the clinical pharmacy department after 5 years. But what after that? My question is always this: what after 5 years? After 5 years, you might be getting 2,000 or 1,000 rupees annually, your, what we say, the increment. And after increment, you might be getting some bonuses. But what after that? Again, the question is, because this job is very much saturated. Okay, this is the challenge after 4 5 years only, not after 10 years or 20 years. This is not your retirement age. After 5 years, this will not be your retirement age. Okay, after 5 years, this will not be your retirement age. Okay, but professionally, you will be retired. Professionally, you will not get any kind of promotion because there will be no vacancy, because there is no position after that. Okay, there is no position after that. That is the truth. That is the truth of clinical pharmacy. Okay, but now another story. This is the secondary part after 5 years. But the current story I'm telling you, I have many of my students who have become clinical pharmacist in one of the, big hospitals in India. Not only, I can tell you the big hospitals like, Nimhans, Manipal, Care, Kims, or, in South India and North India, Medanta, Fortis, and this Max, and the big chains, they are working as clinical pharmacists. Just ask them sometimes, ask them what exactly they are doing. Okay, maybe exceptionally in one or two hospitals, they are visiting doctors, and they are, working with the doctors. I mean, they are visiting patients, sorry, they are visiting patients and they are working with the doctors. Okay, and they are intervening with their, drug charts. But other than that, I was talking to a few of my, student only. What they were telling, that sir, the hospital people have hired us just to fill the seat, just for a formality. They even don't look at us. They feel we are not competent. They were telling, see, my students were so enthusiastic. They wanted to do something in the hospitals, and what they were telling, they were telling, sir, we are not getting the proper role and responsibilities. We are not getting the proper job to do. They are not allowing us to meet the patient. We are sitting in the, hospital inventory or pharmacy inventory. We are just fulfilling the inventories. We are dispensing the drugs, or, we are just looking into the, registers. We are just, maybe sometimes we are checking the prescriptions directly only in the pharmacy, but we are not allowed to meet the patients because the hospitals feel you are not competent. You understand? So this is a big setback. This is a big setback. You might have a job in hand, but you will not have professional satisfaction at all. This is the scenario of clinical pharmacists right now. I'm not telling about all, but most of the clinical pharmacists, this is the scenario. I'm not discouraging you to become the clinical pharmacist. I have some, pros also. See, what are the pros? See, I always tell my students that if you want to become a medical liaison, if you want to go to the medical affairs, if you want to go to the, marketing, if you want to go to the teaching, if you want to go to the research, it is very important that if you serve in the industry, I mean, if you serve in the hospital as a clinical pharmacist for some time, 1 year, 2 year, or 3 years. You know why? Because you will learn the maximum of therapeutics, maximum of drug interactions, maximum of side effects, maximum of pharmacovigilance. You will learn there. Okay, clinical research, either it is clinical research, it is marketing, it is, scientific liaison, it is medical liaison, it is medical affairs. Everything starts with the patient. Everything starts with the patient's behavior. Okay, so it is very important, if after PharmD, if you are becoming a clinical pharmacist for 1 year, 2 years, or 3 years for the experience, it's wonderful. It's wonderful. I always encourage that. But if you're just thinking like, okay, I'll be just a clinical pharmacist for years, then I'm sorry, guys. It is, a very, very much overrated job. It is very much, hyped job. It is very much saturated job. You know, Overrated, hyped, and saturated job. Okay, you are not going to get anything after 5 years. You're not going to get, until and unless. Again, there is the scenario. There is the catch. See, until and unless you don't have any other degrees, you don't have any other specialties, you don't have some fellowships, or you don't have, if you want to go to the administration, you can do MBA, or if you want to go to the medical writing, do, if you want to go to the research or medical writing, you have to do the research, clinical research, or something. You should have something additional if you want to grow in the field. Just with PharmD, you cannot, it is a saturated job. You cannot, work further in your life. As a clinical pharmacist, I'm talking about as a clinical pharmacist. So that's too much about clinical pharmacy, guys. Now let me set up somewhere else. So yes, guys, so you can see here in the clinical pharmacist also, I have come up with some very important thing in the clinical pharmacist also, for the people who are literally enthusiast to become the clinical pharmacist. Because see, I cannot say that if everyone is going away from the clinical pharmacist, then who will handle the patients, and who will, come up with the change which we exactly needed, which we actually needed in the hospitals? Who will become? So there are some enthusiasts. Even we have, I know many people that who are working as specialized pharmacists, like, oncology pharmacist, hematology pharmacist, and community pharmacist, ambulatory care pharmacist, and ICU pharmacist. So those people have some specific skills. If you really want to work as a clinical pharmacist, you have to gather some specific skills. Okay, and those specific skills will help you in achieving the specific domains. Okay, I'll tell you one more story here, that I was in the this what we say this one of the hospital committee. I'll not say the name. One of my hospital committee. I'm working for ICMR as a scientist C. So I got a proposal to the ICMR, funding proposal, the research grant proposal to the ICMR. I was in that committee. So, what I saw was this proposal was written by whom? This proposal was written by a nurse. Okay. Who nurse? Like, nurse, everyone knows. But in that nurse also, she was the heart failure nurse. Okay, she was the heart failure nurse. I was not aware that is happening in India. That even in nurses now they are super specialized, not like ICU nurse, or ward nurse, or OPD nurse, or auxiliary or something. No, there are super specialized nurses. Super. I mean, I have seen in Europe many times since I have started going to Europe and America and these other Asian countries. I have seen these nurses for almost a decade. I'm seeing those different type of super specialized nurses, like some is heart failure nurses, some is emergency care nurses, some is internal medicine nurses, some are orthopedic nurses, some are psychiatric nurses. Those are there already. Super specialized versions are there. But when I saw this in India, I literally was very amazed. And I saw that even where I work in Manipal only, they have started the super specialized nursing courses. They have specialized the super specialized, nursing fellowships. And, in MSc also, they have come up with the different super specializations. So right now, that is a very big dream for me. If I think of like, okay, we can have in the internship, or other than internship, if we can go for specialized courses, or in PharmD only, like first 6 months can be a common internship, and last 6 months could be a specialized internship. Right now it is 4 months, right? I mean, everyone knows there is 4 months, but or 3 months. But if we go for a super specialized technique, like I'm not interested in all four. I'm not interested in dermatology. I'm not interested in suppose psychiatry. I'm not interested in suppose surgery. I'm interested in cardiology. So why I can't do my 6 month, at least not 100% 1 year, but why can't I do my 6 month in only cardiology? Right. So that must be, think of like, okay, if you want to go for the specialization, you can do the specialization right now. And India has started the fellowships. Definitely, there is a fellowship in cardiology. The Parul University is providing right now. Parul also has the fellowship in pharmacotherapy, and, this Tata and HCG and GSS has the fellowships and residencies in, oncology, and Manipal has, in what we say this AMS, antimicrobial stewardship, right? So, there are a lot of things what you can do, what you can think of if you want to become a clinical pharmacist. I'll come to that. I have 1 or 2 slides along with, all the things in that. So, other than this clinical pharmacist, if I come to the other options, we have the plenty of options. We have the full bucket of career options for pharmacy professionals. Okay, all pharmacy professionals, I'm telling, B pharmacy, M pharmacy, I mean, and especially PharmDs. See, PharmDs is PharmD is a course which is very much blended of or if I say in the layman language, a mixture of lot of other things as well. Lot of things, I mean, almost everything. You read pharmacovigilance, you read clinical research, you read pharmacotherapeutics, you read cognosy, you read ecology, you read pharmaceutics. Everything you study. Along with that, biostatistics, clinical research, and a lot of other things, right? So see, this is just a background. But if you want to go to the industry, you have to just have a space, you have to have some specific skills, and you have to choose your interest, and you can go anywhere. But let me tell you what are the top career opportunities or emerging opportunities what you can think of. See, you can see here medical liaison is there, clinical research associate, clinical, and then pharmacovigilance safety associate, these pharmaceutical consultants, academic pharmacist, director of pharmacy. This, let's go to the next chapter and let's see one by one. Okay, let's see one by one. If I I think I have to reshare that. Okay, no problem. Okay, I'm sharing this today since my keypad is not working. Network is it's very difficult. My laptop is hanged. Hi guys, sorry for the technical glitch. My laptop hung actually, and I had to switch it off and come back. Today, why is happening? Okay, no, no, that's okay. Let's start. Okay, so yeah, just tell me if it is visible or not. Just let me just tell. Okay, yeah, tell me guys just once if you can see this first slide, clinical pharmacist, specialty and precision medicine. Yes, guys, can you see it? Okay, perfectly fine. Perfectly fine. Thank you. Thank you, guys. Thank you. Thank you very much. Okay. So first, as I was telling, you have to be a little specific. You have to be, super specialized if you want to become a clinical pharmacist. If you really want to pursue your dreams in the pharmacy or in the clinical pharmacy, then you have to go specialized. You have to go super specialized actually. And I was telling you about the career options, about the colleges in India. So if you want to do some, residency programs, JSS is providing an oncology, HSG is providing fellowships, and Paral University is providing fellowships, and Tata Memorial is providing fellowships. Manipal is providing an AMS. Some more, colleges or universities are, providing in different domains, different super specialties. So you can definitely, if you are thinking of, you can go for that. But in all the domains, there is something which is very special. You can go for a precision medicine. You can go for a precision medicine. Specialty means you can choose your own interest. If you want to go to clinical pharmacy, if you want to go to AMS, if you want to go to cancer, it is up to you. But along with that, what you can do is you can choose precision medicine. Train yourself in the precision medicine in any domain. In any domain, train yourself for the precision medicine. Okay, make yourself very much specific. Learn in the same disease how to become the precision medicine pharmacist. Okay, how the precision medicine pharmacist, like this is just to show you like how the precision medicine works, and how it goes for the validation. This is the research purpose work. But again, precision medicine is that only. Suppose some person comes to you, the person is coming to you with a gastric ulcer. Okay, suppose person is coming with the gastric ulcer to you, and to your clinic. The doctor is seeing them, and they gave some pantoprazole, or they gave some drugs to them, some ranitidine or something. After 2 weeks, again the patient came with the same complaint, like they have the blood in stool, they have the gastritis pain, they have multiple other symptoms, right? So if they come up with the same indication to you again, then it is your job to check like why this patient is getting the same disease or indication again and again, why it is specific, why this patient has something which should be ruled out, which should be checked out to resolve this problem permanently, right? So based on the data, based on their investigational report, based on their biochemistry, based on their the bio investigations, and based on their ultrasound, based on their liver function test or something, based on all the personal test, then you modify the medicine, then you suggest the medicine, then you intervene with the doctor and make a personal prescription, make a personal drug regimen, make a personal drug chart, so the patient can get perfectly cure. Patient will not come again and again to you or to the doctor, right? So it is very important now, even for the pharmacist, like they are the helping hand, they are the equal hand in treating, they are the partners in medical decision making. You have to take it, you have to think of, maybe see, you will tell, sir, in India, this is a valid reason, this is a very valid reason. What I'm going to tell you is that you come up with like, sir, doctors are not entertaining us, right? You will come up with, sir, doctors are not entertaining us, doctors are not listening to us, how can we give the intervene, how can we intervene, or how can we interfere with their charts? No, you should be trained enough, you should be skilled enough, you should be competent enough to interfere, and if you are telling correct, they will listen. I have seen doctors are, doctors are not knowing everything. They don't know everything, and if you are adding to their knowledge, they will definitely understand it, they will definitely understand it. Okay, but if you are going with the feeling of competition, that, oh, they are doctors, we are also doctors, and we also know the medicines, we will not intervene, we will directly prescribe. So that's not the way to compete, or that's not the way to approach anywhere. I'm telling you, that is not the way to approach, that is not the way to intervene. So if you really want to fulfill your goals, if you really want to do something for the profession, if you want to do something really for the pharmacy practice profession, you have to be polite and you have to be competent. If you are competent enough, I am very sure they will not listen one day, 2 day, but when they will see that it is the utmost need, you are the utmost need for them, they will entertain. Okay, so make yourself precision, make yourself competent, make yourself skilled, and if you are skilled, they will definitely do it. Okay, so try to learn precision medicine in your area of interest or wherever you are working right now. See, people get the first job as a clinical pharmacist. Suppose you are working in the hospital, you are in the general medicine. Okay, take the diabetes and learn precision medicine in diabetes. Like what are the types of diabetes? Okay, how to test the diabetes? What are the genetic tests for the diabetes? So find out what exactly the patient need. Okay, find out what exactly the patient need. And if you are a student, you can start learning from now itself. I'm telling you, if you're a student of PharmD fourth year, fifth year, or sixth year, just check 5 patients in your entire PharmD life. I'm telling you, just check 5 patients for the precision treatment strategy. Write my words. You take these. Just see 5 patients in your entire PharmD life. 5 patients, but check them for the precision, medicine system, or check them for the precision, prescription writing for them. Okay. You have the case reports. I know how the case reports are happening in the, how the, case presentations are happening in the hospitals. I know very well. Okay. But I am telling you, if you really want to become the clinical pharmacist, if you really want to learn those things, either you do many case presentations or you see many patients, that up to you. Learn everything, whatever comes the way. But if you really want to learn therapeutics or precision medicine, just take 5 patients. Okay. Study them thoroughly. Thoroughly means for like including genetics, including their signs, symptoms, everything. Try to connect each and every dot, learn, and go to YouTube, ask your friends, ask your colleagues, ask your, your mentors, ask the doctors, anywhere, find the solution, make the precision medicine chart for those 5 patients, and then you will see the real change in yourself. Okay, so this is a wonderful thing if you really want to become, because I cannot deny the notion, I cannot deny the, your favorite, career option as a clinical pharmacist. I definitely understand, but you have to make yourself skilled. You have to learn it. Okay, you have to learn it. You have to make yourself super special. Okay, and in the super specialty, the first thing is precision medicine. Learn the precision medicine in any department of your interest and go for it. Okay, so what's the future of, personalized dosing and pharmacogenomics are shaping the future. And this is true. These are shaping the future. Okay. Pharmacogenomics is the future, because based on the pharmacogenomics, and if I'm just talking about the pharmacogenomics, that's not pharmacogenomics only. That means the environmental factors, food factors, lifestyle modifications in the lifestyle, and your, your sleep, everything has an impact on your genomics. Everything has an impact on your, disease taking behavior. Okay, so you have to learn it, guys. You have to learn it. You have to learn the precision medicine. Specialized areas of precision medicine, as I told you: oncology, cardiology, transplant, infectious disease, wherever, gastroenterology, wherever you want to go and become the clinical pharmacist, learn precision medicine. Okay, and skills you need: therapeutic drug monitoring, genetic, genomic interpretations, and the first of all, the first skill you need is the pharmacotherapeutics, the perfect pharmacotherapeutics learning, and how to connect the dots, how to, learn about the things. Okay, this is about the clinical pharmacist. Let me go to the next part, that is public health or global health pharmacist. If I'm just talking about pharmacist, global health pharmacist, what we are not talking about is global health pharmacist. We are always scared of, not working, or not working with the NGOs, not working with the, what we say, the global organizations. There are multiple global organizations. I am, already the member of ISPOR. I'm the member of American College of Cardiology. I'm the member of, this European Society of Cardiology. I'm the member of ACP. I mean, this epidemiology one, right? So if you are doing something, if you want to become, or learn something really good, then you have to be a part of global scenario. You have to be a part of global drives. Okay, global health pharmacist or public health pharmacist is something which who is associated with the global health programs, like, the FDA, or you are associated with WHO programs, WHO, there are the WHO internships, WHO assistantships who are working in the field, WHO, and we have PHFI, Public Health Foundation of India. Just assist them, go to the field, learn, and really, work with them. And if you work with them, you will learn about vaccination programs, you will learn about disease surveillance, you will learn about antimicrobial stewardship, and that is going to help you. And there are many global health organizations which are working right now, which there are many national health programs where you can work. And the government salary, do you know what's the salary of a pharmacist, hospital pharmacist in AIMS? Do you know that? Can someone tell me what is the salary of a hospital pharmacist in AIMS? We don't have clinical pharmacists right now in AIMS, I believe, but hospital pharmacist we have. Can someone tell me, sir, can someone guess the wild guess of the salary of a hospital pharmacist in AIMS? Any AIMS? Anyone? Can you give a wild guess? 45K. Okay. 32, 30. Okay. 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 See, no one of you have achieved that. The salary of AIMS pharmacist is 90,000. 90,000. The nursing staff in AIMS is taking 80 to 90,000, 1 lakh from the starting entry level job. And you know what is the salary of the people who are working with WHO? 40 to 50,000 initially. But definitely you will not work as a pharmacist there. You will work as a public health pharmacist. You will be taking care of people. You will be taking care of communities. Okay, so that's why this is something new where you have to look at. You don't look into it. You did you ever know that I mean, many of the interns come to me and many of the students come to me, sir, tell us about the jobs of pharmacy in army, jobs of pharmacy in armed forces. Do you know there are the pharmacists and how much they get? They get 45,000 to 60,000 initially. Initial job is 45,000 to 60,000 rupees in army. Okay, so those all come under the public health pharmacist. Those all are public health pharmacist. Okay, those all are the serviced pharmacist. So they must have the knowledge, they must have the skills of vaccination programs, they must have the, yes, railway pharmacist is one of them. Railway pharmacists don't get that much, they get 35,000 to 50,000 somewhere. But and yet another issue is that we don't have clinical pharmacists right now in government organizations like railways and all. But yes, hospital pharmacist, and you are most eligible people. PharmDs are most eligible people for to become the hospital pharmacist also, or to become the normal public health pharmacist there, right? So you can become that. Okay, so just I am telling you this, guys. This is one of the another career option, one of the other fantastic option where you can literally go for is global health or public health pharmacist. Okay, join WHO, join NGOs, join the global health programs. Okay, search in the internet when you scroll the reels, go for that time and just half an hour check what are the new openings in the global health pharmacy, what are the new openings in WHO, what are the new openings in ICMR, what are the new openings in CSIR, or what are the new openings in railways, armies. So there are multiple things where you can go. Okay, so this is one of the another thing. Now pharma, AI and data science, definitely this is one of the best thing what I have learned in nowadays, and this is very much trending. Okay, let's come out of the pharmacy, come to the industry part slowly. Okay, so the third part is pharma, AI and data science. Have you seen data science and how the AI is working nowadays? As I told you, my initial I have tried this. My first picture was developed, the first picture which I showed, there was some flaws. Definitely the clinical pharmacist was written twice, thrice. That was different part, but that was generated by AI, that was generated by this chat GPT, the first picture. So you should know how to use it, and you should know that this could be one of the IPA is one of the option, but I don't know how IPA is communicating with the people, how IPA is using the pharmacist. I'm not sure about the IPA part, I cannot comment on that, but there are other options also in India. You can join, there is one something I'm associated with right now is Indian, this ACPI, Association of Community Pharmacists of India. They develop the community pharmacists. They develop the public health pharmacist. Okay, they work on the public health pharmacist. Even I am, working with them, and they have asked me to prepare some courses for pharmaceutical care services. Okay, recently. So definitely, those people are working towards this. Those people are working towards it. Gautam is writing, in India, the PharmD students have poor recognition. See, this question I have already raised initially. Yes, but it is because we are very new. Okay, and we cannot change anything in one day. Do you know? I think I'm also, very much tired of telling this case, any course assessment, any course impact assessment. The correct word is impact assessment of any course, whether the course is successful or failed. The age of that impact assessment is 23 years, and we are just 11-year-old. If we have, come up, first batch has come out in 2014, we are just 11-year-old. We can assess the impact of PharmD in India at least by 2037. By 2037. Right now, this is the phase of evolution. This is the evaluatory phase. You have to, you are in the evolution phase. You have to develop yourself. You have to find out the ways for you. You have to find out the path for you, and you have to be the torch bearer for your upcoming generations. Okay, so I definitely don't want to say it what you said. I really don't want to comment on it that we have over recognition. Definitely, if you look at look at 10 years back when I was doing my post baccalaureate, I was doing my post baccalaureate in 2011, 12, 13. That time in 14, that time it was nothing. Nobody knew about PharmD. We had to tell the doctors we are PharmD. They used to tell diploma in pharmacy. They used to recognize us by diploma in pharmacy. They used to tell us, oh, we don't need you. They used to tell us like that. I'm not talking about me. I'm very much fortunate that I studied PharmD post-baccalaureate from the Manipal. But I'm telling you the scenario that time. Even here also, many of the doctors were not recognizing us. Right. So this is tragic. I totally get it. It is tragic, but you have to understand that the scenario has changed from last 10 years to now. The hospitals are recognizing PharmDs. Hospitals, doctors, whether for the namesake they are taking, but not all are taking for namesake. I know Dr. Pravalika, many of you know Dr. Pravalika. Dr. Pravalika is now working as the chief of clinical pharmacy and chief of the, that oncology pharmacy department in KIMS. KIMS is one of the known hospital, in Hyderabad, right? She is working and she is very much recognized, within the doctors community, within the hospital community, because she is talented, because she know everything about oncology, and she is delivering the next lecture with us on Tuesday, the webinar, the master class. But I'm telling you that why you will not be recognized when you are skilled, when you are super specialized, you will be recognized. Okay, you will be recognized, right? So it is something what you have to learn. Now let's come back to the pharma AI and data science. So AI in drug discovery, AI in clinical trial, AI in pharmacovigilance, AI in pharmacogenetics, AI in medical writing, everywhere AI is there. So if you are thinking of going to industry, if you are thinking of going to industry by chance, if you are going to industry by chance, it is very much, as I'm telling, as I just told, if you want to become a clinical pharmacist, precision medicine is important. It is similar, if you want to go to the industry, AI and data science is important. It is very much needed. It is the essential part of industry. Okay, nowadays we have the pharma 4.0. We are coming up with pharma 4.1 and 5.0, because we are evolving. I mean pharma industry is evolving. Previously, everything, the drug discovery, and drug making was completely, manually. with some machines, right? But now the process is automatic. That's why we call it Pharma 4.0, because the in this era of AI and machinery and technology, the things have gone automatic. Things are going towards automation, right? And similarly, in some jobs like medical writing, the drug making, or CROs, or if you are into the research, drug discovery, or anywhere, the AI and the data science, it is making the job easy. Okay, and if you are skilled, you can be there at this place to help the people, help the industry in any kind of job. Any kind of job, if you know that what are the tools to use, how these tools are being used, how the pharmacometrics is being used, how the pharmacogenomics is being used, how this bioinformatics is being used. If you are well aware, well versed with these things, well versed with these AI techniques, there is nothing which can prevent you from going to the industry. Okay, so learn AI, and try to learn data science as much as you can. Try to learn Python, okay, and R statistics. These are some tools which you must know, guys. Which you must know. If you are going to industry, or if you want to become freelance, you must know these few things: Python or R, and biostatistics and machine learning. If you know a bit of this, I'm telling you, see, this question has come to me a few days back, that sir, you always focus on AI, you focus on data science, but there are a multiple layoffs. There are thousands of the people, companies are laying off with the people in IT sector. You guys have to understand the difference between IT and healthcare IT. Okay, healthcare, IT part, or healthcare, information technology, or healthcare, what we say it, healthcare AI. Okay, so IT is where these people after BTech, or these people after BSc, or these people after some courses, some bachelor's courses or master's courses, when they go and when they do coding, right? They just do coding, but they need the people from pharmacy, people from medical science to develop the algorithm. They need people from medical science or pharmacy to develop the, to train the algorithms, to come up with the solutions, right? They all alone cannot do that. But if you people learn a bit of AI, learn a bit of data science, learn a bit of Python or R, you will be the master of it. You can guide those people in the right direction. You can come up with the best solutions. Okay, so that is something which has the ultimate power nowadays, which has ultimate power to, go for it, and ultimate power to get you the best jobs. Okay, AI, and then digital health and telepharmacy consultant. This is something new. Okay, I mean, not very new. Many of you must know this, that what is digital health and what is telepharmacy. Teleconsultancy, we call it, right? Teleconsultancy, where we have multiple jobs in industry, multiple jobs in hospitals, and you also can be the freelance telepharmacy consultant. Okay, you can be the freelance teleconsultant. Freelance teleconsultant means you can guide the patients, you can counsel them, you can take care of their medicines, you can guide them on how to take the medicine, guide them on the disease. You can help them in all the aspects. Doctors are not always free, right? So you just have to learn a few things. Post pandemic, the healthcare is going virtual. Definitely it is very important and very true. And online medication counseling, app based interventions, digital therapeutics, these all terms are very new. These all terms are going around, and all the industries are working on it. All the healthcare apps, personalized healthcare apps, are working on on the digital health and telepharmacy consultant. Okay, so this also, Sir, can Kalimat introduce pharma and data science courses? We already have AI diploma, AI essentials for the pharma industry. Okay, so app-based interventions and digital therapeutics. You just have to learn these things. You have to get involved in these things. Okay, learn digital health, learn telepharmacy, and it is really good for the tech enthusiast and those who are interested in remote care jobs. Okay, work from home, telepharmacy. Telepharmacy, you all are very much aware of this term, telepharmacy. So if you are interested, you can be the freelance, you can work for any hospital, you can work for any doctor, you can work for any industry. Okay, so telepharmacy consultant you can be, and digital health consultant we call them. Okay, so this is one of the special thing what you could do, and that's why I have come up with something which you don't know much about. Okay, the fifth part here is health economics and outcome research, HEOR analyst. Okay, HEOR analyst. How many of you know about the HEOR analyst, guys? Tell me. How many? Just give me two roles or two job options or two job descriptions of HEOR analyst. What HEOR analyst does? Can someone tell me what HEOR analyst does? Yes, guys. Don't know what HEOR analyst does? Can anyone tell me? HEOR analyst. First time hearing this. Okay. HEOR analyst, guys. Pharmacoepidemiology research reduces the hospital stay. Okay. Part of pharmaceutical industry. Not exactly, but yes, somehow yes, but not sure about the role. Okay, fine. See, I'll tell you. I'll explain it in a layman language. What is health economics and how the outcome research analyst work? See, suppose there is a disease. Let me take my personal research disease, heart failure, which was my even the PhD topic. Okay, so in my PhD, I had multiple objectives to do. One objective was HEOR. Okay, so why I did HEOR and what is HEOR, you will understand by this. What I did exactly in that, I you know learned the behavior of money. You'll be surprised. I understood the behavior of money from the patient's first time presentation to the hospital, or first onset of the disease to the discharge, and for the 2 years after the discharge, when the patient was at home or something. So I followed them up for 2 years. What I did was I checked for the money, how much money has been spent. Okay, so you will see it is a simple job. No, it is not a simple job. You have to find out how much the patient stayed in the emergency room, how much the patient stayed in the ICU, how much he has consumed of the oxygen, how many medicines he has been used, how many consultations he did, how many times he come by car, how many times he came by bus, how many times he came by the private cab, how much expenses he spent in the hospital stay, ICU stay, how much he spent on the how much his relatives spent when they were with him, how much they spent on the food, how much they spent on the hospital bills, how much they spent on the ECG procedures, radiology, bio investigations. You have to find out everything. You have to find out the disease burden. You have to talk about the disease. You have to talk about the cost, and based on that you have to come up with the models where you can reduce the hospital cost, you can reduce the operations cost, you can reduce the hospital charges, you can reduce the hospital burden, you can reduce the patient's disease burden, you can reduce the caregiver burden. So you have to come up with the, you have to read the models, you have to read the economical models, you have to understand the economics in that. You have to understand HEOR means you have to understand the economics of disease, you have to understand the economics of the patient, you have to understand the economics of the resources utilized in treating the patient. And this job is for everyone. Have you heard of the name of ISPOR? How many of you are aware of the aware of the ISPOR? ISPOR is the international society, international organization which work only on the healthcare research, healthcare economics and outcome research. Okay, so that is a very specific domain where you should learn it, where you should learn health economics and outcome research. Okay, how the patient is being treated. You might have heard of a lot of things, a lot of events in your life. Like, okay, one person was admitted with the headache or with the fever to Max Hospital, and after 15 days when he came out, when the patient came out, how much it was? How much was the charges? 25 lakhs. 30 lakhs, 40 lakhs, 20 lakhs, 15 lakhs. When the patient got admitted with one infection, he came out of the hospital with 25 lakhs bill. Why it is, how it is, where we can cut the cost, how much it was overburdened by the doctors, how much it was overburdened by the hospital, how many tests were useful, how many tests were not useful. This is the analysis health economist has to do. This is the job of health economics and outcome research analyst. But in practical, is it possible? Yes, definitely. Definitely. You search for the health economists. You search for the outcome research analysts, Kirtana. There are many. In India also, have you heard of the name of, PHFI, Public Health Foundation of India? They work on the policy making. They work on the costing. They work on the disease costing. And, health economists are needed in each and every company. You know why? Because they are the people who decide the cost of the drug. These are the people who talk, who come up with the cost of the devices. These are the people who come up with the cost of hospitals. These people are working in the hospitals to make more profit to the hospitals, where they can cut down the expenses, what kind of medicines they can introduce means from the outside, which medicine is perfect for the hospital with good cuts and good percentages. So there are a lot, big lobby where health economics and outcome research analyst can work. But again, the skills you have to learn, you have to learn out of that clinical pharmacy, you have to learn something new. That is why I'm conducting this webinar. You should know these things. You should not just go with these traditional part. I'm going to the clinical research, I'm going to the pharmacovigilance, I'm going to the clinical pharmacy. This is just not done. If you really want to understand BPharm guys and PharmD guys, please, I urge all of you to think out of the box, to look at these options also. Okay, and these options are highly paid. What we have to do other than PharmD to apply for each year? Nothing. You have to do nothing. You are more than enough. Just get involved with ISPOR, learn from those webinars, learn from their courses, learn some courses, get some internship done in CROs, get some internship done in, Eversana, Cactus, or these people are having HUR departments. Every industry has the HUR department. You have to approach by yourself. You have to approach by yourself. Okay, we are also coming up with HUR, but not right now. Maybe in June or July, we are coming up with a 4 months course in HUR. Okay, but that's not right now. I'm just telling. Okay, so, but if you are specialized in these things, your job salaries are wonderful. And people ask me, sir, how can I enter USA without the licensing exam? This is the best thing to enter into any developed country. HUR. If you are a HUR specialist, you can get a job in any developed country. Any developed country. Okay. Sir, what about jobs which consist of writing, etc., safety writing, aggregate report writer? Can you elaborate? Yes, I'm coming to that. Okay, I'm coming to that. If not coming to that, I have some other options to that. Okay, so here, PharmDs who enjoy data, economics, and healthcare policy, this job is for them. HUR job is for them. Okay, then medical science license. Medical science license. Many of you have heard of medical affairs. This is the part of medical affairs, not regulatory affairs. This is the part of medical affairs. So pharma companies need scientific bridges between R&D and physicians. Okay, you must have heard of MSL. Definitely, I always tell about the MSL, medical scientific license, medical affairs. So these are the people who are the bridge between the company, between the industry and the doctors. These are the people who connect the industry to the doctors. Now, let me tell you in a very layman language, guys, that, the people who are working, as a MSL, what they do, They are like, suppose one drug has launched by any company, okay, by any manufacturer or by any marketer. One company has launched some new drug, right? That drug is launched by the company. Now, how to make it reachable to the patient, or how to make it reachable to the doctors? How? MRs, like, first it will go to the marketing team, then marketing team will, distribute it through the journal directors, journal regions, this everything. Then ultimately the MR, the medical representative, will approach the doctors, right? The ultimately this MR will approach the doctor. Sir, this is the new drug. This has this specialty. This has gone through this clinical trial. Please prescribe this drug. This has this much efficacy, and this is the price. How much you will get? I mean, this much you will get. This much I will get. This much the patient has to pay. This is the direct scenario what usually is being done by the people, right? Tier 3 college students learn about this. I'm telling you guys, you can connect with me, you can connect with my colleagues, you can connect with us. That's why we are conducting this. That's why we are conducting such webinars. If you are connected with us, we will guide you. You can ask your seniors, you can ask your, someone who is known to these things. You can ask many people. Nowadays, LinkedIn is one of the wonderful tool. You can connect with anyone in the LinkedIn professionally. Okay, if you want to connect with anyone in professionally and want to learn with them, want to learn from them, want to understand something, just approach them directly with a humble request. Sir, I'm very new to this. Can you please elaborate, explain this, and can I have a meeting with you? Can I have a call with you to understand this, and how I can come to this field? How can I go to this job? This LinkedIn is a perfect tool. Okay, if you want to learn something new, if you are in not tier 3 cities or tier 3 colleges, if you are even in a village, you can set up a meeting with that. Nowadays it is digital. India is digital now, right? From a village, also from tier 3, tier 4, you can connect with anyone from anywhere to learn, right? We conduct all webinars, we conduct everything virtual. You can join us if you want. Like, okay, sir, I want to learn something this. Please suggest us how we make these webinars, how I make these webinars, how I call, expert of these topics. Similarly, because I get requests from you guys, I get requests from the the colleges, I get requests from the students, and based on that only I curate these webinars. And similarly, today's webinar is with some specific topics. So now let's come back to the medical scientific license. As I was telling, see, some company has launched a drug, and this drug has to reach the doctors, ultimately the patients, right? So how they will go to the doctor? They will go to the doctor, MRs will go to the doctor, they will tell about the prices, they will tell about the drug, but what they will not tell is the concern about the drug, what exactly doctor wants to know. So who will tell the scientific updates? Who will tell the scientific background of the drug which has been developed? Here it comes with the position called medical science liaison, right? So medical science liaison is a job usually for the MDs, MBBS, MDs, or MDS, BDS, MDS people. Okay, they are usually understood to be trained in the medicine, so they are perfect for people for the job. But I am telling you guys now, almost 500 plus PharmDs. You can write this, you can note down this fact. Almost 500 people of PharmDs are working, and M pharmacy, pharmacy practice, or pharmacology, these three are working in the field of medical affairs. They are the good people. Good people means they are most talented people. They get lower salaries, and they give the higher output to the industry when they are working as medical science license. Understand that? So it is very important. So what they do exactly, they talk to the doctors, they conduct the conferences, they conduct the seminars, they conduct the key events where all the doctors come and learn about the drugs, and where all the they train the medical representatives, they train the marketing people, they train the marketing team of the company, right? And they are the key what we say, the key bridge between the doctors, between the key opinion leaders, what we call them doctors, and between the industry. So and the vacancies. Do you understand? Do you know how much vacancies, how many vacancies are there? Each drug, for each drug, there are thousands of the medical scientific license. There are thousands of the medical affairs people. When I'm talking about thousand, what does it mean? See, every zone, every area needs one medical license at least for one drug, or one area of drugs or one category of drugs. Suppose I'm talking about breast cancer drugs. So breast cancer drugs, two, three drugs are developed by suppose Novo Nordisk or suppose Novartis. So there will be the medical scientific license in every zone, every region. There will be the medical scientific license for these drugs or this drug category, especially to conduct the bridge, to make that bridge, to fulfill that bridge. Okay, so there are thousands of the vacancies in each area, so you can understand how many drugs are there, how many categories are there. So if you are interested in anything, that's why I'm telling again, I'll repeat, if you want to become a clinical pharmacist, be yourself super specialized and then achieve for the medical scientific license. And the job of medical scientific license, do you know the salary? If you are a MDS or MD pharmacology doctor, you will get 1.5 lakh to 2 lakh per month in the industry. And if you are a PharmD, you will get minimum 1 lakh salary in the starting as a scientific liaison in the medical affairs. Do that. But you have to make yourself definitely skilled. You have to learn the pharmacotherapy, about pharmacotherapy, everything you have to become. Okay, every aspect of the pharmacotherapy you have to learn. Especially if you want to go to the cardiology drugs, you have to learn the cardiology, heart failure. So you don't have to learn the entire pharmacotherapy for this. You have to become the specialized in that. Okay. This is about medical scientific license. Then industrial pharmacy, R&D, FDF developments, formulation science. Even now, BPharms and PharmDs can go to this area also. Where to apply for the medical license? Yes, where to apply? There are the jobs in Naukri.com. There are the jobs in other platforms. But the best thing for these jobs is make a list. This is a simple thing I'm telling you about the medical license or any job. See, suppose you want to become a medical license in the cardiology. Find out how many companies, big companies, are making or marketing the cardiology drug in India. Okay, then go to their websites, go to the company website, go to the vacancy and find out. Always, every month, every 2 months, in every company, you will get the medical scientific license jobs. Okay, you will get it. So you have to spend some time. The industries will not come with the job profile to your home, like, okay sir, can I, or ma'am, can I get you for my job? No, you have to search it, you have to apply, you have to approach, you have to do it by yourself. Okay, no one will do it. Okay, so this you have to do it by yourself. Okay, and industrial pharmacy, definitely for the PharmDs, for the this is majorly for the B farm and M farms. So if you are good enough, if you are learning enough, then you please go to the nano formulations, learn about biologics, learn about preclinical and clinical pharmacology, learn about analytical chemistry, microbiology. In the neuro products, life care neuro products, there are multiple things. And you can go to the quality assurance, you can go to the drug regulatory affairs, you can go to the natural products, you can go to the information technology, you can go to the formulation and development. Lot of things are there. Okay, formulation development. So what are the roles? Roles in, pre-formulation, bioequivalence studies, stability studies, and emerging sectors, again, biopharma, mRNA technology, advanced drug delivery system. So these are the new things, updated things in the industrial pharmacy. If you really want to go to R&D or, formulation development or or the drug development, you have to learn something new now. Biopharma, mRNA techniques, bioinformatics, drug development, and codings. Those are the things you can learn. What are the jobs for B farms specifically? These all are for B farms. See, B farms and maybe clinical pharmacist could be for PharmDs all alone. Okay, or there also B farm also can go. There is no restriction. But I'm telling you, all the jobs what I'm talking about, HEOR, whether it is HEOR, whether it is scientific license, whether it is industrial pharmacy, all are for PharmDs and BPharm both. These are for BPharm and PharmDs both. There is no restriction, there is no specifications, there is no specific thing that only PharmDs can go. BPharm, PharmD both can go to these jobs. These are for all pharmacy professionals. See, these all, three jobs what I'm talking about, four, five, even the telehealth and all, health economics, medical license, industrial pharmacy, these all what I'm talking about are for PharmDs and BPharm. Okay, not only for families I'm talking about all pharmacy professionals. Okay, all pharmacy professionals can go ahead for these jobs. Okay, and then now medical affairs, as I just told, and scientific strategy. So scientific strategy is there are multiple things in that. Okay, so there are multiple things in that, like life cycle management of the drug, scientific messaging, and the internal trainings. It is not about the when you go to the field. It is not about the working in the field, but companies also need under the medical affairs and scientific strategies. This is the different job role, not only the direct medical scientific license. This is the strategy specialist. Okay, similar job in medical affairs, but where you will be utilized in life cycle management, drugs life cycle management. You will be specialized in scientific development. You will be specialized in internal trainings. You will be specialized in making the strategies and policies for the drug development. And more than that, not only drug development, but more than that, you will be utilized in making the policies for drug positioning in the market, like how to position the drug in the market in this competition. So your brain will be used there. Your brain will be used there. Okay, so medical affairs and scientific strategy is one of the wonderful job. Definitely, you might have not even searched for, you might have not even understood for, or you might have not even heard of this, but there are. And again, there is not only one job. Every company has medical affairs and scientific strategy managers for each drug. Each drug, every company has for each drug. Sir, after B pharmacy, which is best in PharmD or MPharm, this is completely on your interests, Ravanti. Whether you want to go to hospital more, whether you want to go to PharmD oriented jobs, whether you want to go to the clinical research, whether you want to go to the industry. Okay, so it is up to your interest. I am nowhere in place to tell you what to do. Frankly, these jobs also I'm telling you because just to just to create your interest towards something new, not only towards the clinical pharmacy or not only towards the medical writing or something, but something very specific. You should do something out of the box. Okay, I will tell you. I'll come to all the questions, guys. Don't worry. So if you want to go to the medical affairs and scientific strategy, you should have very strong clinical background and business acumen or business knowledge. Okay, I will tell you about the clinical research, guys. Wait, in YouTube, people are asking about the clinical research. Okay, now entrepreneur in health tech or pharma startups. See the list of pharma startups here, guys. If you really want to become a person in the startups or person into the business, there are the jobs. So look at the startups, online pharmacy. Maybe if you have the good funds and good strategy, you can become the online pharmacy. You can open the online pharmacy. You can become the medical transcription generator. You can become the medical transcription translator. You can become the medical like there are multiple jobs, telephonic scribers or teleconsultancy and many other things. Okay, many other things you have. Then medical record administrator, health health tech softwares you can develop. You can work on drug rehabilitation facilities. You can work on nutritional health awareness programs, and you can make the applications. You can make the you can run the campaigns. You can be the entrepreneur in such industry. Okay, and then virtual reality apps for the mental health, alternative medical devices, medical services, surgical scrubs, uniforms. I mean, there are many opportunities to do the business. Medical tourism, home healthcare facility. These all are the types of things what you can literally go into and become the entrepreneur. Okay, become the entrepreneur. So some question is here. Sir, which has more scope after that I've already. Sumangla has this question. If B pharmacy or PharmD having same jobs, then what's the use of 6 years? See, the use of 6 years is very specific and very important. And what I say, if I say in my words, it has many advantages. Okay, as I told you, medicine, scientific lies in jobs. Okay, so always in some job criterias, not everywhere, in some job criterias, like in the medical scientific license, regulatory affairs, medical affairs, and in the clinical research. In the clinical research, PharmDs have the what we say, the edge over the B farms, right? PharmDs, first of all, clinical pharmacist, B farm are very rare to go. This job is especially, the as I was telling about the global health pharmacist or precision pharmacist or specialized, super specialized pharmacist, that can be the PharmDs. Okay, that is the major difference. And other than that, see, I'm not discouraging, I'm just telling you the facts. And then other than that, the difference when you are asking what is the use of 6 years, then these license jobs, these medical affairs job, these medical writing jobs, these CRA jobs, and these clinical research, data management, SAS programming, these specific jobs, if someone with BPharm is going for them, again going for those jobs along with PharmD, I'm very sure that PharmDs will have edge because they learn these things more than you guys. They learn pharmacotherapy more than you. They learn pharmacology more than you. And these people are more into the clinics. These people are more into the patients. So in industry also, in the drug development, in the clinical research, what is important? Not only the clinical research skills, but understanding and knowing the patient behavior. So the PharmD people, because they have directly interacted with the patients, they have directly worked in the hospital, they have worked in the cases, they know the better patient behavior than BPharm. They know the better clinical research than BPharm. They know the better, patient decision-making strategies, drug strategies than BPharm. So they have the edge. Definitely they have the edge, and that is the use of 6 years. Okay, that is the use of 6 years over than 4 years. How BPharm can achieve these things with some trainings, but definitely BPharms have some different things. See, in some things like, as I'm telling about the medical affairs or, health technologies and all, both have the similar pace. Whether you are a BPharm or PharmD, you have the similar pace. Okay, everyone has to do and develop some specific skills. Everyone, whether you are a BPharm or PharmD, you all have to develop the specific skills. Okay. Is pharmacy license required to open online pharmacy? Yes, if you want to practice pharmacy in any form. If you want to practice pharmacy in any form, whether you are a teacher also and you are teaching hospital pharmacy, you are, handling the hospital pharmacy in the hospital, you need the license. Okay, but if you are completely into the online teaching, or if you are completely into the, mentoring, entrepreneurship, and you are not practicing pharmacy, in that case, only license is not necessary. But license is most of the things, it is beneficial only. Okay, it is beneficial only. If you are having the license, it is beneficial only for all of you. Okay. Yes, Gautam, always. It is always wonderful. It is always wonderful to have the, additional certificates, additional value added to your, CV. Okay, so let's come back to this because it's already 6:43, guys. We have to finish it in 15, 16 minutes. Okay, let's do it. So, why entrepreneurship is exciting? PharmDs are launching the apps. Many of the PharmDs are working like they are launching apps, wellness brands, medtech platforms, and there are the examples. If I tell you, AI-based medical management, clinical decision tools, e-pharmacies, and definitely it is good for the risk takers with some innovation on their mind, right? So it is good for the students or the professionals who have the risk taking capabilities, or who are the risk takers, so they can go to the entrepreneurship. Okay, that's one of the good job. Okay, so I think I cannot tell you everything. Academic researcher, PhD in translational medicine, Okay, so you can go to the PhD, you can go to the research. Academic researcher means you can become an academic, you can become the academician, you can become the assistant professor, associate professor, and you can do the research in many things like stem cells, nanomedicine, immunopharmacology, or you can be the translational medicine specialist. Okay, by and you can become the academic researcher. So that is one of the fascinating job. You might be thinking that's a teaching. No, teaching also has the fizz. If you are something specialized, if you know something really good, then you can become the specialized. Okay, so there are medical data reviewer, clinical data reviewer, medical scribes also, and MBA. Guys, I have to finish it actually here. It's almost 2 years, 2 hours. But these things, these four, five, and fifth, up to 15 from the 10th, I will take in the next session. Okay, next session maybe I'll take on Sunday only, upcoming Sunday. Okay, because if I start describing, I cannot take my next class at 7. I thought it will be finished in 1.5 hours, but it's again, as I told you, it takes a lot of time, a lot of discussion. So MBA also I'll take next time. Here I can tell you a little bit about MBA strategies, MBA streams. What I actually brought to you is MBA in healthcare management, MBA in pharmaceutical management, MBA in hospital health systems, MBA in healthcare informatics, MBA in hospital health systems, MBA in health economics is there, MBA in operation and supply chain is there, MBA in clinical research management is there, MBA in strategic innovation is there. So there are many types of MBAs which now you can go and you can become the manager and you can go into the management. MBA data analytics is there. So that's why I came up with this MBA streams in healthcare and pharmacy. Okay, so I will describe this in our upcoming part 2. Okay, next Sunday I'll come up with the part 2. So right now, please write your questions. I will take your questions and we can finish off in time. And it's almost 2 hours, guys. I got some technical glitch also. But with that, I will wind up the session here. Now I'll take the questions only. Okay, guys, is it fine? I'll take the questions here, and definitely next Sunday again we'll meet at 5. And I will come up with more additional career options, additional things to tell you. Okay, you can tell me now in the chat box what you want to learn more in the next webinar next Sunday. Okay. In next session, talk about CDM. Why MSL certificate course is so expensive? Because there are not many people providing this, and there are not many people skilled with MSL certificate. Okay, only a few people are skilled, only a few colleges are providing this, so that's why it is expensive. You know why medical writing is very cheap? Because anyone can start medical writing certificate course, anyone can teach them, anyone can get skilled easily, right? So it is about the skills. MSL certificates are so expensive because only a few organizations are doing it. And Clemed is dedicatedly cutting the cost and coming up with these courses slowly. I mean, we cannot come up with every course immediately. In last 4 years we have launched many new courses, many new things. So definitely, but it is not very something easy for me also. It is not something very easy for you people to learn, and it is not very much easy. Okay, give me 2 minutes, guys. Let me come up with the feedback form. I'll share the feedback form and then I'll take the questions. Okay. Next session, talk about the clinical research. Clinical research, I did not talk intentionally today because it is very common and I have talked about this many times, but definitely in the next session, we'll talk about clinical research. Okay. We will talk about the clinical research as well. So you write your questions here. I'll take some questions today and I will curate, I will, prepare my next, course, next webinar based on this only. So let me just share the feedback form with you guys. Okay. Yes, it's here. YouTube guys also please stay for a minute. I'm sharing the feedback form with all of you so you can get the certificate. And Again, yes, next Sunday, if everything goes well, next Sunday again I'll come up with the next Sunday or Saturday, whatever, whenever I'll fix it, and I'll come up with a good plan. I will come up with a more comprehensive things, and we will again talk on this topic next Sunday. Okay. Yes, I will analyze all your feedbacks. You can write your questions in the feedback also. Okay. Yes, I have shared the feedback form here. Guys, to skill some required pharmacy students, yes, how to approach the hospital internships that I will take. I regulatory affairs also, regulatory six. Okay, guys, so I want to show you something, everyone here. So we have come up with these courses. If you are interested, this is definitely I have to show you. So this is something what we have launched, and this is starting, June 1st. So if you are interested for today, we can, arrange some scholarships. We can arrange some, kind of what we say, the discounts for all of you. Array, yaar, why it's not happening? So these are the courses, and let me share in the YouTube also, guys. Please, 1 second. I'm opening the YouTube, guys. I cannot share in the another device where I have to open the YouTube in the chat box or in the, here only in this laptop. Then only I can share. Okay. Your certificate will be prepared in 3 days. By Wednesday, you will get it. Don't worry about the certificate, guys. It's a webinar certificate, but surely you all will get it. Okay. By Wednesday, fill the form. And I'm just telling you about the course. Okay. And I'll take the questions as well. Let me share the feedback form because YouTube people are also there waiting for the certificate. Just give me a minute. It is a bit slow today. I'm not sure why. Yeah. So 1 second. It's opening, guys. Yes, guys, it's opened. Just give me a minute. It takes time, yeah. Because I was running the YouTube in another device now. That's why I'll take the questions. Yeah, come on. Yes. Yes, YouTube guys. So I'm sharing this link here, okay, from the people from YouTube. I'm coming to the questions, guys. Just give me a minute. Yes. Yes, I think people in the YouTube got the form. Please fill that form, guys. Please fill that form. Okay. Okay, guys. So let me take the questions. Okay. If we have all filled the form. Just too much. Okay. Yes, let me take the questions now. Yes, sorry guys. So I hope you all get the feedback form. Where is the form? People are joining late and asking for where is the form, guys? Come on. Okay. Still, here's the form. You please fill up the form here. It's here, guys. Okay. Okay. So questions in MBA courses, which course has wide scope in domestic and internationally? That I'll discuss in the next class because I'll talk, comprehensively. How to approach hospitals for internship in sixth year. That also I'll tell. Interested in medical coding. Medical coding, I'm coming up. There is a medical coding things. I want to learn pharmacovigilance. You can join definitely. How to approach hospitals? This question you have asked many times. Yes, every time you're copy and pasting this question here. Come on. How to start preparation for drug inspector? Okay, I'll take this. For industrial jobs, which are the good options? I like industries, IQVIA, Excel, etc. What are the salary ranges? That also, see, salary ranges, I cannot tell you salary ranges. I can tell you only for the jobs, not from the companies. Okay, so like if you are going for the medical writing, starting salary job is 20 to 30,000. If you're going for pharmacovigilance, again, pharmacovigilance associate or drug safety associate, somewhere around 20 to 30,000. Okay, and if you are going for medical license, as I told you, as an intern also, if you're going in the medical affairs, you will get 40,000, 50,000, and when you are getting a job you will get 90,000, 1 lakh. And if you're going to work in the medical coding, definitely the job is good, around 20 to 30,000, 40,000 also. If you have the CPC license, you can get 50,000 also monthly. So it depends upon like the jobs. If you have SAS, I'll tell you about the SAS programming, data analytics also in the next class. Okay, details of regulatory affairs, I'll come up. Okay. Okay, guys. So I'll discuss these things for sure. Okay. Okay, Ashish Chaudhary is asking, I'm currently in eighth semester of BPharm and I'm interested in building a career in pharmacovigilance. However, uncertain whether it would be more beneficial to enter the workforce immediately after graduation or to pursue pharmacology. We can discuss this more, definitely. Skills required to become HEOR. I have told you skills about the HEOR, Aswath. You have to learn the economics, health economics. Okay, you have to learn the economics and you have to learn the research, because outcome research is very, very important. Okay, when we talk about HEOR, outcome assessment is important, and outcome assessment can be done by the research. Research means when you learn about the clinical trials, when you learn about the registries, when you learn about the longitudinal studies. So with that, you talk about the outcome research, and based on that you predict the cost and you make the predictive cost. Okay, and you make the cost effectiveness models, right? So when you want to become the HUR, there is like HUR analyst, there is a specific courses or value additions to the CV that can be done around HUR only. Okay, how to start preparations for the drug inspector effectively? That I'll bring some drug inspector only better. Skills required to become the data analyst, AI data analyst. Python is one of the good option. Okay, Python is one of the good option. Learning Python, learning data analytics, learning R, and learning biostatistics. Okay, if you learn these three things, you will become the data specialist. Medical coder, yes, medical coding has a wonderful scope. Okay, medical coding, medical scribe. I was talking to, I was supposed to talk about them in the next slides. Medical coding, medical scribing, medical reviewer. These are the wonderful career options again in again for the pharmacy people. So I'll tell all of these guys right now because I have to start a class again at 7. So I would like to thank you. Okay, I would like to thank you, and let me, yeah, just a brief, just a minute, just a minute. So yes, this course is right now open for the registrations. Okay, just let me give you a glance. The impact course, we call it impact course, 7-in-1 executive diploma in advanced clinical research, and you will learn about clinical research, medical writing, pharmacovigilance, CDM, regulatory affairs, data analytics, artificial intelligence, medical coding, and additionally you will get industrial internship and ICA GCP training program. In this course, this is a 120 hours learning, 10 months, and weekend classes, Saturday, Sunday. Okay, 100% placement assistance, and I will share this in the group, so you will learn about this course. This course is provided. Lot of things are there, lot of things to learn in this. Okay, and the course cost is just 10,000, 9,999 for 10 months. This is the entire course fees. Okay, and actual course fees is 50,000. Actual course fees is 50,000 because we have our own CRO, and these courses are backed by CSR. CSR is corporate social responsibility. And okay, so these are funded courses. These are funded by our own CRO. So just we charge 10 to 20% or 30% of fees from the student. Rest is funded. Okay, that's why we are providing these courses at such a nominal cost for you. And if you are taking these all other courses from our side, pharmacovigilance, medical writing, regular affairs, one by one, then it will be coming in 35,000, around 35,000, and you are getting here only in 10,000, 9,999. So you will be saving more than 14,000. Okay. So these courses are available. One is 7-in-1 for the long-term people who wants to learn everything, and one for the specific people who want to learn 3-in-1, like only medical writing, pharmacovigilance, and clinical data management. This is a basic type of course. This is a 6 months course. If you are interested in any of these courses, please connect, and I will share these courses in the group, guys. Okay. So yes, these are the very much discounted courses for all of you. So if you want to register, you can do it. And let me share the feedback form, guys. Fill it fast so I can wind up. And we will definitely, I'll see you very, very soon. Okay. I'll see you very, very soon in the next class. Okay. So the part 2 will be coming soon. For that also, you will get the certificate if you are spending 2 hours with me. I definitely accept it. I definitely, respect your time, guys. So yes, with that, guys, thank you very much for joining, and please keep your questions posted in the group. I think you cannot post in the group. That's okay. But your questions are here. I will analyze these questions and I will coming up with these answers. Okay. So thank you very much, guys. Thank you for your time and thank you for your efforts. Thank you. Thank you, guys. Thank you very much.